7 months into the pandemic, and a lot of nursing homes across Texas still do not have enough protective equipment to keep their residents safe. I-Team first reporting on the PPE shortage at nursing homes back in June, and now there's a new report out says the problem is actually getting worse. Investigative reporter Brian New tonight explains.
My mother was one of the people who helped build this country.
When Mary Castro tested positive for the coronavirus back in May, her nursing home was on lockdown.
So at that point,
and so her daughter, Rosie Davis, was not allowed inside to see her.
I could only see my mom through a window.
At the age of 75, Mary died from COVID. Ever since, Rosie says she can't help but feel as if not enough was done to protect her mother.
They were our parents, our grandparents, and they have been literally swept under the rug as if their life doesn't matter.
More than a quarter of all COVID deaths have come from people living in nursing homes. And experts say using PPE, masks, gowns, gloves, is one of the best lines of protection. And yet, in a new report from the consumer advocate group, Texas PIRG, 20% of nursing homes had less than a week's supply of PPE when surveyed in August. And more than 10% in Texas had no N95 masks.
It is absolutely unconscionable that Texas is dealing with severe PPE shortages at this point in the pandemic.
Advocates say this problem can be solved in two steps. One, by the president using his authority under the Defense Production Act to increase PPE production. And then by Congress passing a bill that would create a national PPE distribution plan.
My mom was a nurse for 18 years before she retired.
Rosie says her mother deserved better. And as deaths in nursing homes reach more than 60,000 due to the virus, Rosie says giving them the protection they need is long overdue.
They took care of us, and now it's our turn as their children and their grandchildren to help take care of them.
So in the past, nursing homes have been able to buy their PPE supplies individually through third-party suppliers, but this year that supply chain has been disrupted. So what we've seen is nursing homes are now competing with states who are competing with the federal government, all for these same supplies, and that's driven up the price and has left many nursing homes without the supplies they need. In Dallas, Brian New, CBS 11 News.
A maddening problem, Brian. Thank you.